Hello, I'm Dr. Azman, and today I will be discussing the integration of artificial intelligence and 3D printing in surgical planning for orthopedic surgery. This technology is rapidly transforming how we approach complex cases, offering new solutions and enhancing patient outcomes. Let's begin with an overview. AI, or artificial intelligence, refers to computer systems that can analyze large data sets, recognize patterns, and assist in decision making. 3D printing, on the other hand, allows for the fabrication of physical models based on digital imaging. Together, these tools are reshaping preoperative planning. What are the benefits? First, accuracy. AI algorithms can analyze radiographs and CT scans, helping to pinpoint malalignment or deformities with remarkable precision. Second, customization. 3D printing enables the creation of patient-specific anatomical models, guides, and even implants. Finally, efficiency. These technologies streamline planning and can reduce operative time. Now let's talk about applications. In trauma, for example, AI can automatically segment fracture fragments and suggest optimal reduction paths. For deformity correction, 3D printed models aid in visualizing complex anatomy and rehearsing osteotomies. In joint reconstruction, custom guides improve implant positioning and alignment. To illustrate, I'd like to present a real-world case. A 16-year-old male presented with a malunited femur fracture. Using AI-driven software, we analyzed the deformity in 3 dimensions. The data was then used to generate a 3D printed model of the femur and a custom cutting guide. With these tools, we planned and executed a corrective osteotomy, achieving excellent alignment. The patient's recovery was smooth, with restoration of limb function and significant improvement in quality of life. Of course, there are challenges. Costs remain significant and technical expertise is required. Regulatory considerations are evolving, especially regarding custom implants. It's also important to validate AI algorithms to ensure safety and reliability in diverse populations. Looking forward, the prospects are exciting. Advances in machine learning will further improve diagnostic accuracy. More affordable and accessible 3D printing will broaden applications, even in resource-limited settings. Collaboration between engineers and surgeons will drive innovation and improve patient care. In conclusion, the integration of AI and 3D printing holds tremendous promise for orthopedic surgery. By embracing these technologies, we can enhance precision, personalized treatment, and ultimately improve outcomes for our patients. If you have questions or would like to discuss potential collaborations, please reach out. My contact details are on screen. Dr. Azman, email nmzusm.my, WhatsApp +601 9917 966. Thank you for your attention.